Hi friends, welcome back to 1000 questions and answers series. First question, the common mode of transmission of poliomyelitis is droplet, fecal-oral route, direct contact, through vector. And the answer is fecal-oral route. Next question, last stage in polio immunization campaign is follow-up, mopping up, catch-up, all of the above. It's known as mopping up. Next question, hepatitis A is formerly known as infectious hepatitis, serum hepatitis, contagious hepatitis, none. It's known as infectious hepatitis. Next question, who discovered hepatitis B virus? Louis Pasteur, Blumberg, Robert Koch, none of the above. Hepatitis B virus discovered by Blumberg. Next question, the drug preferred for chloroquine-resistant malaria in pregnancy is mefloquine, primaquine, cloxacillin, quinine. It's cloxacillin. Next question, who discovered anti-rabies vaccine? Louis Pasteur, Edward Jenner, Joseph Lister, none of the above. Anti-rabies vaccine discovered by Louis Pasteur. Next question, causative agent of yellow fever, flavivirus, Lyssa virus, RNA virus, none of the above. Yellow fever caused by flavivirus. Next question, Japanese encephalitis is caused by paramyxovirus, group B arbovirus or flavivirus, toga virus, none of the above. Japanese encephalitis is caused by group B arbovirus or flavivirus. Next question, brucellosis in man is known as anthrax, undulant fever or Mediterranean fever, Q fever, none of the above. It's known as undulant fever or Mediterranean fever. Next question, leptospirosis is otherwise known as hemorrhagic fever, Weil's disease, blackwater disease, none of the above. Its other name is Weil's disease. Next question, commonest complication of measles in young children is otitis media, pneumonia, glomerulonephritis, substance sclerosing panencephalitis. It's otitis media. Next question, route of administering streptomycin against TB, subcutaneous, deep intramuscular, intravenous, intradermal. It's deep intramuscular. Who discovered Mycobacterium tuberculosis? Robert Koch, Louis Pasteur, Lister, none of the above. It's discovered by Robert Koch. Mycobacterium tuberculosis discovered by Robert Koch. Next question. A route of administration of BCG: intradermal, intramuscular, subcutaneous, intravenous. It's intradermal administration. Next question. Vaccine contraindicated in pregnancy is rubella, typhoid, diphtheria, hepatitis B. It's rubella vaccine. Next question. Post-auricular, occipital and posterior cervical lymphadenopathy is classical presentation in case of chickenpox, measles, rubella, mumps. It's in rubella. Next question. Carriers are important in maintaining the chain of transmission in all of the following except polio, typhoid, measles, diphtheria. Measles. Next question. Best disinfectant for cholera stool is bleaching powder, cresol, coal tar, formalin. It's cresol. Next question. Guinea worm infestation is common in workers of step wells, ponds, fields, cotton mills. Step wells. Next question. Dracunculiasis was more common in which of the following state? Orissa, Rajasthan, Tamil Nadu, Uttar Pradesh. It's in Rajasthan. Causative organism of diphtheria is Escherichia coli, Corynebacterium diphtheriae, diphtheria virus, and none of the above. Corynebacterium diphtheriae. Next question. Incubation period of diphtheria is 5 days, 2 to 6 days, 10 to 12 days, 25 days. It's 2 to 6 days. Next question. Characteristic bull-necked appearance is seen in tetanus, diphtheria, polio, and all of the above. It's seen in diphtheria. Next question. Tuberculin test was discovered by Clemens von Percut, Louis Pasteur, Edward Jenner, none of the above. Tuberculin test discovered by Clemens von Percut. Next question. Confirmative test for TB. Mantoux test, chest X-ray, sputum examination, AFP test. Sputum culture is the confirmatory test for tuberculosis. Next question. Vaccine against tuberculosis is tetanus vaccine, BCG vaccine, MMR vaccine, DPT vaccine. It's BCG vaccine. Next question. The main vector of dengue fever is Aedes aegypti, Aedes albopictus, Aedes pollinations, Aedes culturales. It's Aedes aegypti. Next question. Which is not true about dengue hemorrhagic fever? Thrombocytopenia, hepatomegaly, shock, plasma leaking. And the answer is shock. Next question. Infective period of Aedes mosquito for classical dengue fever, breakbone fever is 10 to 20 days, 20 to 30 days, 30 to 40 days, lifelong. It's lifelong. Next question. API stands for Annual Parasitogenic Index, Average Parasitic Index, Animal Parasite Interval, Annual Parasite Incidence. It is API stands for Annual Parasite Incidence. Next question. Japanese encephalitis is transmitted by Culex vishnui, Culex jellidius, all of the above. It's all of the above. Next question. Animal host involved in Japanese encephalitis transmission include which of the following? Pig, cattle, horses, all of the above. And the answer is all of the above. Next question. All of the following are vectors of chikungunya virus transmission except Culex, Mansonia, Anopheles, Aedes aegypti. It's human Anopheles mosquito. Next question. Causative agent of malaria is Plasmodium, Mycobacterium, parasite, and none of the above. And the answer is Plasmodium. Next question. Drug of choice for malaria: chloroquine, chloramphenicol, tetracycline, interferon. And the answer is chloroquine. Next question. Classical triad of congenital rubella syndrome includes all of the following except patent ductus arteriosus, hydrocephalus, cataract, deafness. It's hydrocephalus. True about citrate in ORS: increase shelf life, nutritious, cheaper, tastier. It used to increase shelf life. Next question. Antibiotic treatment of choice for treating cholera in an adult is single dose of tetracycline, cotrimoxazole, doxycycline, furazolidone. And the answer is doxycycline. Next question. A convalescent case of cholera remains infective for less than 7 days, 7 to 14 days, 14 to 21 days, 21 to 28 days. It's 14 to 21 days. Next question. Drug of choice for carriers of typhoid is ampicillin, chloramphenicol, cotrimoxazole, clindamycin. It's the drug of choice for carriers of typhoid is ampicillin. Next question. Isolation in patient with salmonellosis is done till fever subsides, till Vidal becomes negative, till 3 stool tests are negative for 48 hours of chloramphenicol treatment. And the answer is till 3 stool tests are negative. Next question. The infectivity of chickenpox lasts for 3 days after the onset of rash, 5 days after the appearance of first crop of vesicles, till the last scab falls, till the fever subsides. It's 5 days after the appearance of first crop of vesicles. H1N1 is otherwise known as swine flu, bird flu, wild flu, baby flu. And the answer is swine flu. Next question. Incubation period of mumps 10 days, 18 days, 21 days, 30 days. And the answer is 18 days. Next question. The drug of choice for treating cholera in children is tetracycline, doxycycline, furazolidone, cotrimoxazole. It's cotrimoxazole. Next question. The drug of choice for treating cholera in pregnant women is tetracycline, doxycycline, furazolidone, cotrimoxazole. It's furazolidone. Next question. The freshly prepared ORS, oral rehydration solution, should not be used after 6 hours, 12 hours, 18 hours, 24 hours. And the answer is 24 hours. Next question. Chances of viral hepatitis type C becoming a chronic infection are 10%, 20%, 30%, 50% or more. It's 50% or more. Next question. First step in the TB control program is early detection of sputum positive cases, chest x-ray, distribution of anti-TB drugs, none. It's early detection of sputum positive cases. And the last question. Dengue shock syndrome is characterized by the following except hepatomegaly, pleural effusion, thrombocytopenia, decreased hemoglobin. And the answer is decreased hemoglobin. And thank you to everyone.